I'll preface this video with a disclaimer. I am not an orthopedic surgeon, nor have I ever aspired to be one. I'll further that to say that I'm not even a surgery first person. In many cases, I don't look at surgery as a chance to fix something, but rather in my worst case scenario view of the world, I look at surgery as a chance for things to go from bad to worse. Don't take that to mean I have a negative view on surgery overall. There are times that surgery needs to be done, goes well, and in some instances results in even saving a dog's life. Generally though, with dogs and with humans, I think people think surgery is a chance to get a dog or a person back to as good as new, and the sad truth with most things, particularly with orthopedics, that isn't the case. The goal of surgery should always be to make the patient better than they were before surgery, but that isn't the same as making them as good as they were before they had the issue. Can you tell I'm a glass half empty guy? I give that disclaimer to frame my opinion on stifle surgery. I don't take it lightly, and it is an area that my opinion and recommendations have changed over the course of my career. I know, in today's world, admitting that your opinion may change based on new information, research, etc., is a dangerous omission and a perceived weakness, right? There are a number of conditions like chronic Achilles tears, elbow and shoulder issues in older dogs that I think non-surgical options are likely better than surgery. Over the course of my career, we have seen dogs with back issues go from being emergency surgical cases to most of them not even needing surgery. The truth with the knee is that surgery is often the best option to return a dog to function. Furthermore, when we talk about cruciate disease, particularly those dogs that have had issues all or most of their lives, I do think this is the one case where many of these dogs are better post-surgery than they ever were, period. There are a couple of key points that I think are difficult for people to understand. The first is that just because someone is performing cruciate ligament surgery doesn't necessarily mean they're good at it. If we are talking about a dog that we want to return to a high level of athletic performance, then we need to get that dog in the hands of someone with a track record of returning dogs to, you guessed it, a high level of performance. In a future video, I'll discuss my recommendations for finding a veterinarian in general, and the same will apply to surgeons. I think too often we think that all professionals are equal, and that just isn't the case. Whether it's attorneys, accountants, doctors, or veterinarians, there is incredible variability when it comes to passion, knowledge, experience, and skill. Too often as consumers, we make our decisions based on convenience, cost, and location, and unfortunately, those two lists don't always mesh. What I'll say to finding a vet that's good is it's going to take some research, and this may have to go beyond just asking your veterinarian, kind of depending on your relationship with them. I'd also caution against just taking the recommendation of a buddy whose cousin had his dog's knee fixed. Having the surgery and having a great outcome can be wildly different ideas. The issue is that many of the procedures or the equipment to perform them are patented. What that means is that any veterinarian that has the money and desire to perform the procedure can go learn to do it and then just start performing it. What that means is that you'll have vets with experience that ranges from doing a couple of months to a handful a year to hundreds and even thousands a year. That's a range of experiences and outcomes. When our surgeon retired this summer, he had done over 8,000 TPLOs in his career, and he's only in his early 50s. Conversely, I once interviewed a veterinarian who was also trained in the procedure. He very confidently and arrogantly explained how good he was at the procedure, how quickly he could train the staff in case management, and how refined his technique was, and on and on. When I finally got a chance to get a word in and ask just how many of the procedures he had performed, the answer was 2. Confidence doesn't always equal skill. When we look at the surgical techniques available, first I think it's important to discuss the differences in how surgery is approached versus in humans. 26 years ago, when I tore my cruciate meniscus, it was initially misdiagnosed. Once the initial swelling subsided, I was able to run, bike, and lead a pretty normal life. Where I would run into problem was doing things like playing basketball or baseball when quick lateral movements would cause it to feel like a trick knee and send me to the ground like a sack of potatoes. One morning I was knelt down petting the dogs before heading into the clinic, and I stood up only to have my meniscus flip forward and the wheels came off. With humans, the surgery is aimed at reestablishing stability within the joint. In my case, they used part of my patellar tendon to reconstruct the job of the cruciate. Today, if I tore the left cruciate, I'd likely have the joint cleaned up, but I'm not sure I'd have the repair. I still run and bike, but I'm not doing those quick lateral movement sports I was in my mid-20s. With our canine patients, while the general structure of the knee is similar, the geometry is quite different. The reason that I wouldn't need a repair in my good knee is that we have gravity working for us. Our bones are essentially stacked, one on top of the other essentially. In the dog, the rear legs are angled. So even in a standing position, there is sliding that is taking place when the cruciate is damaged. This is why many of these dogs will just toe touch on the affected leg, because just the act of standing is causing issues. This is also the major reason that braces don't routinely work in dogs. It is difficult to overcome these sliding forces with an external adaptation. Similarly, any of the repair techniques that have aimed at an intra-articular fix, reconstructing the ligament within the joint, have not shown to work. This leaves us with surgery options that are aimed outside of the joint. When I was just a wee lad in vet school all those years ago, the extracapsular technique was still the most widely used, but the TPLO was gaining traction and quickly displacing it. I'm not going to discuss every possible technique that is available, but rather I'll focus the discussion on these two techniques with a disclaimer as to why I feel they are the two we should focus on. Before we discuss the techniques, I think it is important to make one note on the meniscus for either surgery technique. There is considerable debate as to whether one should perform what's called a meniscal release, even if the meniscus is not damaged. The arguments are that as performing a release is damaging tissue that previously sound, and you are further contributing to the development of arthritis. Whereas advocates for a release will say that any such development does not affect clinical outcome, and it prevents a meniscal tear down the road, which requires a second surgery. I'm in the camp of meniscal release. I've seen too many owners extremely frustrated when the answer to their dog's return of lameness is a second surgery to inspect the meniscus. I don't like to speak in absolutes, but in all of the post-op surgeries I have been involved with, I cannot think of one where we had to go back in to address a meniscal issue if the meniscal release was performed. And at the end of the day, it's kind of like Duclaws for me. There are a lot of passionate opinions. As long as the surgeon has sound reasoning for their decision, I'd be hard pressed to have this be a deal breaker as to whether they'd perform the surgery. What I would caution would be if you bring it up and they don't have a reasoned answer, which may mean that they skip inspecting the meniscus because it takes skill and time. In the next video, we'll discuss the extracapsular technique, and depending how windy I get, likely a separate video for just the TPLO to wrap up the series.